Well, we heard that warning from Jeremy Hunt earlier on the programme this morning that we'll all pay a bit more tax, and there will be what he calls very difficult decisions on public spending too. With nurses due to go on strike across the NHS soon and more strikes in the public sector, I can now speak to the General Secretary of the UK's biggest union, Unison, which represents more than 1 million public sector workers. That is Christina McAnea, and she joins us now. Thank you for being on the programme this morning. Jeremy Hunt said the NHS can find efficiencies. Is he right?
I'm sure any organisation can still find an element of efficiency savings, but I think it's a bit of one of these words that's a bit of a red flag to many public sector workers because it so often means cuts. And that's the worry, is that the NHS is basically on its knees at the moment. I've been spending the past week going around speaking to our members across the country, Unison people who are paramedics and nurses and theatre staff in hospitals, and I can tell you that they don't think there's much room for any efficiency savings. What they want to see is more investment in the NHS. They want to see a pay rate that actually encourages people to join the NHS and, crucially, to stay in the NHS.
The latest figures that we showed to Jeremy Hunt on A&E waiting times show a record number of people waiting more than 4 hours, and the number waiting more than 12 hours was up 30% to almost 44,000. What kind of impact could spending restraint have on the NHS? Could it be dangerous?
Of course it could. And you've just said it yourself there. Waiting lists are at an all-time high. We've got the highest level of public dissatisfaction with the NHS since it started. We've got 135,000 vacancies in the NHS. People are waiting in ambulances outside hospitals for 5, 6, 7, as long as 10 hours. They're basically using ambulances as another room of the hospital, which is not very an efficient use of ambulances. And this will have an impact. It's already having an impact on British people, and it will just only get worse. When I hear politicians talk about, difficult choices to be made, of course that's true. But there's also difficult choices. Well, difficult things will happen if we don't make the right choices and if they don't make the right choices. And one of those will be the NHS is almost ready to collapse. And excuse me for sounding like a conspiracy theorist, but I've heard so many people say it now. Is this partly a deliberate attempt by the government to run down the NHS in order to turn around and say we'll have to bring in some private organisation to run it? Now, I hope that's not, and a bit of me thinks that's not what they're doing, but what they're not doing is taking the right choices about investing in our public services. And it doesn't make sense economically either, because we've had 12 years of near enough austerity or public sector pay freezes. And what's happened? The country hasn't grown, the economy hasn't grown. The dreadful experiment that we had with Liz Truss, where she tried to just ramp all of that up, just showed what a bad strategy that is. And actually, if you invest in the working people of this country, if you see them as wealth generators and you actually give them decent pay to be able to generate that wealth, then that makes a difference to local economies. And that's how you get the economy back on its feet again.
I just want to come in because do you really believe that the government is deliberately trying to run the NHS down? Because I feel like there are some people in government who might find that, a bit offensive.
I'm sure. And as I said, I don't like to be a conspiracy theorist, but I honestly, sometimes when I go around and I see what's happening in some of the NHS, when I hear stories from people who are working, Unison members who are working as nurses, paramedics, when I hear what they have to tell me, a bit of me does think, what is going on here? How can any politician allow this to happen, to something that is so valued by the British public? So no, I'm not saying for definite that's what's happening, but every now and then it does enter my mind that may be what's happening. I suspect, I would absolutely hope Jeremy Hunt certainly doesn't think that, given his views on the NHS. But I think sometimes to sort of blame everything on, external other world affairs like Ukraine is wrong, because the problems in the NHS and the social care sector were well known long before the Ukraine crisis happened. It's not been wages that are pushing up inflation. And some of the decisions that were taken just a couple of months ago by the Tory government have certainly made things worse. And none of the people that I represent in Unison who do these essential public services were responsible for any of that. But they will now be the ones being told, we can't give you more money because the country's in such a state. Well, I'm sorry, but politicians have to decide where they're going to spend their money. That's what they're paid to do, is take those difficult decisions.
Let's talk about money, because of course there are the pay negotiations going on. Given the fact that, as you accept, money is really short in the NHS, you're worried that it could lead to dangerous outcomes. Is it really right that the Royal College of Nursing is asking for a 17% pay rise?
Well, that's what the Royal College are asking for, and they've now got a yes vote in a large number of large parts of the NHS to take industrial action. We're balloting our members, over 300,000 in the NHS, who our ballot closes on the 25th of November, and we're asking them to vote yes for strike action too. So we will definitely be talking and working with the Royal College of Nursing if we get a yes vote too. There aren't pay negotiations going on, I'm afraid, sad to say. Ministers are telling us there's no more money. There's nobody sitting down to discuss this with us. And what I keep saying is a strike's not inevitable in the NHS. A strike's not inevitable anywhere. A strike is a symptom of a problem. It's not in itself the cause of a problem. And I would urge Jeremy Hunt and other government ministers to sit down with the trade unions and actually talk to us about how we can solve this.
The Health Secretary, Steve Barclay, described a 17% pay rise as neither reasonable nor affordable. Is that the kind of level that Unison might be asking for as well?
Well, we're looking for an inflation-proofed pay award. I think it's really important that staff get something that actually means they can stay in work and look after their families at the same time. The offer the award that has been made to NHS workers in England, Wales and Northern Ireland is a £1,400 flat rate. Now, for most nurses, that represents, and most nurses and people in that professional band, if you like, we call them within the NHS, for most of them, it represents between 4 and 4.2%. Inflation is now running at well over 10%, expected to be even go as high as 12%. That cannot be right, that we're expecting these workers to continue to do their job, a very demanding job, and yet take what is in effect a pay cut. And no wonder so many of them are leaving the sector. They're going to take jobs elsewhere. You look at what happens in the retail sector. Tesco, Asda, Sainsbury's, Lidl, Aldi have all given their staff at least 2, and in some places 3 pay increases this year. Now, the government answer to us is always, we've implemented the pay review body report in full, and that's true. But what they could do is reconvene the pay review body to actually say to them, things have changed drastically since they took their decision to award £1,400, and actually ask them to reconsider and see what would be a fair offer to give to public sector workers and indeed NHS workers.
OK, thank you very much indeed for being on the programme this morning. Christina McAnea there of Unison.
Thank you.